Hey, we're going to talk about what's called nocturia. Nocturia is just a fancy word for getting up to go pee in the middle of the night frequently. Now, frequently means any more than twice a night, and we kind of expect 0 to 1 times a night to be totally normal. Once you start getting up there into like 3, 4 times a night, A, it's super annoying, and B, there's probably something you can do about it. So I want to go over the many different factors that can contribute to you having to go to the bathroom more often. And so let me start my list. Now, the most common things that can cause you to go pee in the middle of the night are drinking lots of water before going to bed, having the habit of going to pee frequently during the daytime, and having a history of going to pee frequently at night. We know that when there is more stress going on in your life or you're having poor quality of sleep, that can cause the need to go pee more often. There is also a relationship between obesity as a risk factor of making you need to pee more often at night, up to like 2 to 3 times as more because of that. We know also that caffeine and alcohol consumption can increase urinary frequency and act as a bladder irritant. And there are conditions like hypertension and diabetes and the medication that are associated with those that can make you need to go pee more. Also, being pregnant. On that note of being pregnant, I also want to throw in the idea of edema. So if you're someone who typically has a lot of swelling on your legs, this can be something that also is related to having to go pee a lot at night. So what can you do about it? First thing is go see a pelvic floor physio, because we can usually really help address some of the factors that are contributing to your frequency at night. But it's important to distinguish if you're someone who is peeing frequently with very little amounts or peeing frequently with lots of urine going on. So that can usually be resolved using like a bladder diary. But I'm going to give you some tips that are just general that you could apply and probably help yourself quite a bit if you weren't ready to go see somebody about this. So tip number 1, ways to improve your quality of sleep. So we know that doing a relaxing activity 20 to 30 minutes before bed, be it breathing, meditation, yoga, taking a bath, reading a relaxing book, anything that helps you get into your body and off your phone can really help with that sleep quality. We know around sleep hygiene that using your bed purely for sleep or sexual activity, but not like hanging out in your bed or eating in your bed or whatever, working from your bed. Keep it as its sanctity of sleeping. If you are someone who's a napper, this can be affecting the quality of sleep at night. So maybe avoiding naps or making sure not to go to bed too early, because we don't actually need that much sleep. And it's of course subjective, but just to keep that in mind. And we can't always necessarily avoid thinking about hard things in life before we go to bed, but I kind of have this rule of like, if you can't fix it in the next 3 minutes, then like leave it for tomorrow. So maybe don't go into a spiral about all the things that are going on in your life right before bed, because that can increase your stress hormones and really affect the way that you're sleeping. I say quality of sleep because a lot of people blame the fact that they're waking up at night on the fact that their bladder is always needing to go pee. But the reality is you might actually be really lightly sleeping because you're having a stressful sleep or you're not sleeping that well. And it's very easy to blame a bladder, because if you just emptied your bladder, you'll be able to sleep. You see the relationship? It's not always the bladder's fault. The second tip is to modify your fluid intake. So usually we're suggesting that people should be drinking about 2 liters of water per day. And that includes all of your food and coffees and teas. So start to notice what it is that you're consuming, and if you are someone who thinks that like hydration is the best, it is, but it's not as much as we think it is. So that's really important to keep in mind. The other is you shouldn't be drinking right before going to bed. So we usually suggest reducing or stopping the intake of fluids right before bed for a couple of hours, and after dinner, starting to go by like more sips rather than like full cups of liquid that you should be drinking. If you are someone who has hypertension or diabetes and you're on some sort of diuretic medication, maybe talk to your doctor about the timing of those drugs and when you should be taking them if that's affecting your sleep and your urination at night too. We have 2 more. Third is tips for your body. So back to this idea of like pregnancy and leg swelling. If you're someone who's retaining a lot of fluids, be careful with how much sodium you're consuming. And hang out with your legs up above the wall, so you could be draining that fluid from your lower limbs. And also any kind of like compression stockings or like lymphatic drainage, all of that could be really helpful as well. Pelvic floor muscle training is definitely part of helping some people with nocturia, because if you're someone who has incontinence during the daytime due to pelvic floor muscle weakness or general body weakness, then pelvic floor muscle training will also help your pelvic floor do its job better at night. Now, all of this is very valid and will help, but I want to emphasize the relationship between our bladder habits in the daytime versus our nighttime habits. So just like some people have very needy and annoying bladders, and so working on your bladder habits and your urge management during the daytime can be really helpful for your nighttime frequency as well. If you can work on the information coming from your bladder while you're sleeping. Let's say it wakes you up. Use the same distraction, relaxation, pelvic floor muscle range of motion tools that you would when you're managing the urge during the daytime, and apply them at night. I know that it will keep you up, especially at the beginning, because you're trying to calm yourself down, you're trying to distract yourself, you're trying to move away from the fact that your bladder's just like, please, let's empty me and I'll sleep better. But eventually your bladder will learn that, like, we don't listen to a whiny bladder at 4 o'clock in the morning, and your habit will start to change. This is also super important if you're postpartum. Often we make an association between like feed the baby, go pee, go back to bed, or vice versa. And suddenly you're no longer feeding at that time, but your body's waking you up at that time. And so that's an association more than it is like a bladder problem or a pelvic floor muscle problem. Learn to soothe the urge. Don't give in to everything that your bladder is saying. See if you can put yourself back to sleep, and eventually your bladder will learn. So those are just some quick tips. Come check us out at Pelvic Floor Physio if you have any questions. And otherwise, I wish you best of luck and sound sleeping.